Okay, hello everyone, welcome. This is a special presentation about the top 15 questions to ask your child's audiologist. My name is Dr. Ben Thompson. I am an audiologist who works with pediatrics, children, and adults at CEID in Berkeley, California, which is the Center for Early Intervention on Deafness. So whether you're with us live here for the next hour or you're watching the recording, wherever you're seeing this, welcome, get comfortable. We're going to go through some important questions from my experience working with different families and from my research, questions that are essential to ask your audiologist, and some of them might not be so obvious. We're going to cover the implications of these questions and how it affects children and their development with speech, hearing, and their overall development as a child. So this is exciting. Thanks for you guys who are here live. A quick intro is that I went to the Doctor of Audiology program in San Francisco, California. That was a few years ago when I finished my school, graduated in the doctorate program, and now I'm working at CEID, which is a great program, a great center for speech, hearing, and other topics related to a child's early development. So it's a great place to be. And I'll get right into it. First with a little intro that the presentation here will be about 30 minutes. And then after that, there will be an opportunity for live question and answer. Also, you'll notice if you're watching this live in the chat box, there's an opportunity to ask questions as we go. So get comfortable, and here we go. We're going to focus on children from birth to 5 years old. And as we know, this is a critical period for language development. And it's also a focus on CEID, on our center, on working with children who are before kindergarten. Those are the critical language development years, and those are critical years to be hearing well. So for children who have hearing loss and who are managing that with hearing devices of some sort, hearing aids, bone anchored devices, or cochlear implants, having a strong relationship with your child's audiologist is going to excel your child's growth. And let's involve the parent's role here, because for a child under 5 years old, of course, they're not advocating for themselves, and the audiologist knows all these different resources that are available, but sometimes the parent has to be the main advocate for the child. Oftentimes, the parent who asks more questions, who asks for some favors, asks for some extra help, some hand-holding during some portions, those are the parents that get more of the resources. So the important thing to take away here is that whether you're a parent or you're working in the speech and hearing world, is that there are important questions to ask that may not come up in the average appointment, but they can propel a child forward with additional resources or with more specific care and attention to what's going on. As an audiologist, as a hearing doctor, we work with audiograms. An audiogram is a hearing test, and it's a very simple result, pretty much. We measure hearing on a scale from low pitch to high pitch, like a piano keyboard, and we measure the softest sound anyone, or in this case, a child, can hear at those different keys on the keyboard. So with the result, we can categorize someone's hearing as normal, mild, moderate, or severe. And of course, normal hearing means they don't need a hearing aid. They're pretty much good to go. Any of these other degrees of hearing loss means that we are treating their hearing loss with some form of treatment. Usually that's a hearing aid or another hearing device for children who have a more permanent condition of hearing loss. So from the last page here, you can see that if the thresholds or the data points, the softest sound the child can hear, if that's near the middle of this graph from left to right, like this, from left to right, then that's going to be around the moderate range of hearing loss. So this is the right ear and the left ear for this one example, where the results are in the moderate hearing loss range. And what that means, if your child or a child you know wears hearing aids, and if they had a moderate hearing loss, it means that without their hearing aids in, they wouldn't be able to hear people speaking softly. they wouldn't be able to really understand speech clearly unless they're looking at someone's face. This is without their hearing aids. And it would be pretty obvious to be around someone with this degree of hearing loss that they have hearing loss. Unless they're wearing hearing aids, then they're able to hear almost all of sound around them. And for a child with incidental learning and all the speech cues that are in our vocabulary every day, especially at school, that's quite important. So that's a little intro into a hearing test and being able to categorize different types of hearing loss. As an audiologist, we categorize the hearing configuration differently, and that affects how we're treating it with the size and the strength and the power of the hearing aid, as well as speech therapy and how the speech therapist would work with the child to improve their outcomes. So there's a lot of nuances to that, but we'll keep it simple to start. All right, now about your child's hearing loss, we're going to go through about 15 important questions, and we're going to start with 3 here. So an important question to know as a parent, maybe a child has been newly diagnosed with hearing loss, and if it's not related to the eardrum, if it's not related to an ear infection or fluid behind the ear, then the hearing loss is likely permanent, and that's called sensory neural hearing loss. But we want to make sure. So we ask, is the loss permanent? There's different kinds of pathologies or makeup of symptoms, and some of them might be related to syndrome. Some of them might be related to certain genetic factors. Other times it's just hearing loss that we can't exactly connect to any other history, but there is research that looks into the different types of hearing loss and which ones are more permanent, which ones might fluctuate, and then which ones would get worse over time. So that goes to question 2, asking the audiologist, will the hearing change or will it get worse? For most cases of nerve-related hearing loss, it's a slow progression where every year, from 1 year to the next, there's not really that much change. But if we look back 5 years, 10 years, 15 years, we see a fairly linear progression of losing the clarity of speech over time. But certain conditions that are related to genetic hearing loss or kinds of syndromes, they have a higher risk for a more rapidly progressive hearing loss. And that's really important to know because we're going to be monitoring and testing their hearing more frequently. And as well, we're going to potentially think about the current treatment they're using on their ears, their hearing aids, or whatever. What would be the next step if the hearing loss gets worse? Would that treatment still be appropriate, or would they need something else? All right, guys, question number 3. Thanks for watching this. Thanks for being here. Question number 3 is, what could be the cause? So what could be the cause? What could have caused the hearing loss, really? A lot of times when children are born and they're diagnosed with hearing loss, they would be invited to have a genetic workup, working with the genetic team at a hospital to determine, is there some genetic risk factor for hearing loss? And that would be good to know for the family, and having some therapy with the family to understand that maybe there's a genetic component, or it's related to some medical pathology. That's when ear, nose, throat may get involved with imaging, an MRI or a CT imaging, to look into what other structures of the hearing and balance system may be affected by this. And could there be something else that the hearing is related to that needs attention as well? But in reality, as an audiologist, I know that a lot of times the hearing loss is called idiopathic, meaning that there is no direct knowledge of the cause. We simply don't know. We don't really know why the hearing loss happened or what's going on. And that can seem a little scary. That can seem that's some unknown. There's some unknown there for parents. But it's rest assured, because many children, many adults even have an unexplained hearing loss where something in the nerve chemistry or the nerve makeup allowed there to be this loss. All right, so if you're still listening, you're still with us, that's great. I am here in our Oakland clinic at CEID. Right now I'm recording this from our clinic in Oakland, in East Oakland. And there's a nice portrait behind me. It looks like somewhere in Southeast Asia. Anyways, about your child's hearing loss or a child that you work with, another good question to ask the audiologist is, would you suggest genetic counseling for our family? So if the ear, nose, throat surgeon and the audiologist and that whole team at the hospital, the medical center, if they are suspicious that there may be a genetic component to the hearing loss, then that's something that's brought up. When I worked at UCSF in San Francisco, the pediatric team for these kinds of children who have hearing loss, they usually did test for a genetic risk factor. So then that was a conversation with the family of, okay, you might be interested in having more children, or you already have children and you may have a genetic predisposition for hearing loss. So we're giving the family that information to then decide what they do with it. And that can be a heavy subject, usually involving a counselor or a social worker. Another question here about your child's hearing loss is, how will the hearing loss affect speech and language development? Very important. It's good to ask the audiologist this question, who can give an answer. For example, if a child had that moderate flat hearing loss, then my response would be, well, if the child's not wearing hearing aids, they're going to miss most of speech around them, and that's going to affect their learning and their education at school, around other kids, even in the home. So it would significantly affect speech and language development. Now, of course, an audiologist is not the one to diagnose a speech and language delay or a certain developmental age. That usually comes from a speech therapist. My mom is actually a speech therapist. That's how I got into this field of audiology. So it's a good question to ask the audiologist to make sure the whole team is on the same page. But it's a great question to ask your speech therapist. It's usually something that will be covered in the first appointment or two about how the hearing loss, which may be permanent, may affect speech and language development. Now, feel good, rest assured, because what we know is that when a child is diagnosed with hearing loss early, and we'll get into the timeline milestones here, and when a child is fit with treatment or hearing aids early, they can expect to have age-appropriate, relatively normal speech and language development. Not to say their hearing will be the same as a kid without hearing loss, but with the right therapy, with the right treatment, and CEID, our center in the East Bay, really focuses on this, of having the right services, having the right therapies, and children who are born with this disability can actually make an amazing life for themselves and enter kindergarten in a great place. So that's inspiring and something we see every day at CEID. Okay, now about hearing aids. So the pros and cons of different hearing aid styles. I just want to mention that we're about halfway through the presentation part of this, and then after there'll be an opportunity for some question and answer. So the pros and cons of different hearing aid styles, that's good. Let's imagine that your child or a child that you work with is diagnosed with hearing loss, and the audiologist and the ENT determine that hearing aids are the best and only treatment for them. There's no surgery, no medication that's going to repair what has been lost. So the conversation goes to, well, hearing aids are typically the best and only treatment for permanent hearing loss. That opens up a whole box, and it's a really long discussion about the pros and cons of hearing aids, about how do you get a 1-year-old or a 3-year-old or a 4-year-old to wear something on their ear that might bug them and bother them at the beginning. And we would cover the different styles of hearing aid. The most common style of hearing aid has an ear mold piece in the ear with a tube and a hearing aid, the actual device that sits up and behind the ear. And those stay on the ears of kids really well. There's, of course, some training period about how we educate the kid and how we make it fun to use the hearing aid and all this. But anyways, it's a good question to ask of what are the different pros and cons of various styles of hearing aids? Because as we all know, the doctors tend to know a lot that they don't share with the client or the family or the patient. So part of this presentation is empowering and educating the family or the parents in this case about which questions you need to know to ask and to make sure your audiologist covers these kinds of questions in the appointments. And as an audiologist, I can say we always try to do our best, but sometimes there's other things that are in the appointment that are really holding our attention more. For example, if a child has multiple disabilities or if there's something else involved in the case that is really important to talk about, then there just might not be enough time in those initial appointments to cover all of these questions. But in our mind, in the background, we are keeping all this in mind to provide the best service as possible. All right, keep with us, guys. You're doing great. So options for paying for hearing aids. That's the next good question to ask your child's audiologist. Who's going to pay for the hearing aids? Is it covered by insurance? What kind of insurance do I need? Am I on a Medicaid program? For example, in California, Medi-Cal is our state Medicaid program, or California Children's Services is a program for children who have disabilities, including hearing loss. And there's also private insurance. Maybe that's a Kaiser or a different kind of private insurance, Blue Cross Blue Shield. All this depends on many factors, but asking the audiologist, what are the options to pay for hearing aids? The golden outcome is to have the child wear the devices that they need to perform the best and develop their speech and language the best at the lowest cost to the family. So ask your audiologist that. It's a good idea. Now, how do we prove that the hearing aids are working? That's a really good question, because if it's an adult, you can say, I can say, hey, mom, are those hearing aids working? Are you hearing just fine? Like the way you did when they first fit them at the appointment? And she says, yes, they're working good. And I say, okay, great. And I can ask her something and she responds like, okay, she hears me. So it's easier with adults. But for children, if it's a 2-year-old who still hasn't started talking and might be all over the place with their attention and not consistently respond even when they are hearing, you can't ask them, hey, do you hear me? Because they can't reply yes most of the times. And it's even if you try to get their attention by saying something, they do not always consistently respond in the same way an adult would. So how do we prove the hearing aids are working? Modern hearing aids for kids, they have internal diagnostic checks where they're able to run an internal check to actually determine if the hearing aid is working. And hold on one sec. Okay. In addition, I'll just ask you, anyone who's just joined in, to just try to mute yourself if you just joined in. Thank you so much. Nice to have you. So the question here is, how do you prove that the hearing aids are working? At the time of the appointment, the fitting appointment, when a child gets new hearing aids or hearing aids for the first time, there's a verification process where the audiologist runs the hearing aids through a series of tests with our equipment, which can only be done in person, that determine the output of the hearing aid, the sound entering the ear. It matches the prescription or the necessary sound output for a kid of a certain age to develop normal speech and language. And that's based on the hearing test we did. So why are we always doing hearing tests? It's to determine if we should change the settings of the hearing aids. All right. Amazing. So if you guys are just joining, you can ask any questions in the chat. And if you're watching this on the recording, stay with us. We're about halfway through this presentation here. So that's how you prove hearing aids are working. And it's a good idea to ask your child's audiologist, how can I prove that these are working at home? Another thing is that there's what's called a listening tube, which is typically given in new hearing aid a new hearing aid box or bag at the time of the appointment where the parent can put in this little tube. It's like a stethoscope, but it goes straight to the ears. And then they can listen to the hearing aid through this tube. They can talk into it, and they can at least know that it's on, it's functional, it's working. That's something that does often get overlooked at the beginning appointments for new families with kids with hearing loss. So that is something to make sure you can do on your own, so that when you put the hearing aid on your kid and they're living their day, you can have the confidence that you're doing everything that can be done in order to give your child speech and language development. Hang on for 1 second, guys. Just stay right here. I'm going to plug my charger in. Thank you. Because that often is an important question that people want to know. It's an important question to know, well, what am I doing everything that needs to be done for my kid who has hearing loss? Because there's so much to learn, there's so much to do, there's so many resources. Am I doing enough? Am I doing what's necessary? When the hearing aid's actually on the ear and you know it's working, then you can rest a little bit. Okay, I'm doing everything that can be done. Now it's just time to live and enjoy each other's company and get the kid to be interacting as much as possible. All right, so now we're going to talk about education. Other questions to ask your child's audiologist. When should my child begin speech therapy and how often? That's a great question. Typically, if the child has hearing loss and that hearing loss is diagnosed, then we do refer the child to a speech therapist to do an evaluation, and they would make the final call on speech therapy. How often? Usually it's on a weekly basis, between 1 and 4 hours a week, and that's also determined by the speech language therapist. If the child does not have a hearing loss, but they have a speech delay, then we would also refer them to a speech language therapist, typically after 1 year old, because some kids don't even start talking until 1 year old. So that's my answer to this question of when should your child begin speech therapy and how often. All right, so next question here, is there a parent group in my area? I put this question in this presentation because having a child, okay, parents who have children who have hearing loss, the 90% of the parents of children with hearing loss have normal hearing and haven't been exposed to the hearing loss world or hearing aids before their kid. So what that means is that there's a lot of families and parents out there that feel kind of alone and don't have other families, don't have that support network of families and kids who are going through the same thing they are. Therefore, asking your audiologist and going online as well, if there is a hearing loss for children, a pediatric hearing loss support group for families in your area, that could connect you to learn a lot about someone else's experience, maybe make less mistakes and save some time on your own journey, and learn some tips from other parents who might be a little farther in the journey than you. And that could introduce you to another family. So you can ask your audiologist this as well. Could you introduce us to another family that have already gone through these hurdles and these challenges so that we can talk to them, learn from what they've learned, and make a friend in the process of someone who really knows what you're going through. Okay, next question is, are assisted listening devices recommended for my child? An assisted listening device for children is typically an FM system. FM means frequency modulated. Essentially, it means there's something on the hearing aid that connects wirelessly to a microphone. And that microphone is typically close to the teacher's voice or close to a parent's voice. For children who are under 5 years old, which is the theme of this presentation, the FM system is very rarely used. Once a child hits school age, kindergarten and older, the public school district has what's called an IEP, Individualized Education Plan, and that would be appropriate to set up an FM system or some other kind of speaker in the classroom so the teacher's voice can be nice and clear for the child who has trouble hearing that voice and the child who has a harder time hearing the voice because there's background noise in the classroom. And what we know about children with hearing loss is that it's harder for them to hear when there's background noise. All right, guys, thanks for being with us. Thanks for making it this far. Whether you are a parent who has a child with hearing loss, looking to know the best questions to ask your child's audiologist, or you're a professional who's looking for resources and to get some new perspective on this whole process, because it is a journey and it takes time and it takes patience and commitment, and it's not easy, but it, of course, is very rewarding when we can expedite a child's speech and language development and get them interacting in that normal or in that peer group as quickly as possible once they hit school age. That's really crucial. Let's talk about the typical timeline for a newborn diagnosed with hearing loss. So we do our best as a medical profession in hearing, as a hearing loss profession, as audiologists, to diagnose a hearing loss within the first 3 months. There's the newborn hearing screening, and if that does not pass, then we do a full diagnostic evaluation, typically in the hospital, where we can determine what level of hearing a child has via a test we do when they're sleeping called an ABR, auditory brainstem response test. If that test shows they have permanent hearing loss, then we try to get them in hearing aids before 6 months. And imagine what it's like to put hearing aids or ear molds on a child who's less than 6 months. They don't want it there. They're going to try to swipe it away. And their ear is growing so rapidly that we need to make new ear molds every few months. So that process takes a lot of time and energy from the family. It takes a lot of showing up to appointments. It takes, quite frankly, a lot of appointments to monitor the hearing, make sure everything's set up appropriately, and to upgrade them to new ear molds every so often. All right, so by the time they hit 1 year old, that's when a normally developing child would start to be speaking, saying their first words. And that's also around the time, slightly later, for kids who have hearing loss, that's around the time that we would expect a child who has been diagnosed before 3 months and fit with hearing aids before 6 months. By the time they're 1 year, 1.5 years, that's when we also expect them to be showing some speech and language signs as well, which is really great. Now, when they're 3 years old, their speech and language is developing further and they're starting to get closer to preschool. By the time they're 5 years old, they're in public kindergarten. Okay, so I made some homework here. I have a printout which covers a lot of these questions, and the printout will be sent to all the live attendees, and the link will be linked underneath the recorded video wherever you're watching this, so that you'll have the most important questions to go over with your doctors and your child's audiologist about how to live with hearing loss and how to make sure your child and the child has all the resources that they need to excel and to grow and to be the best young adult, to be the best adult they can be. So it's very much investing in their future, and it does take a lot of time and energy, but having these questions at your ready as a resource is only going to do good things for the child and their future. I'm going to exit here and stop my screen share. So that has been our presentation. I'm so happy that you've been able to learn and watch. And now's a good time for anyone who's watching live to ask questions. And if you're watching this in the recording, you can ask any questions underneath if you're watching this on YouTube or any other platform, and we'll do our best to respond. Of course, you can also reach out to the Center for Early Intervention on Deafness, CEID, in Berkeley, California. My name is Ben Thompson. I'm a pediatric audiologist there. So you can send me an email, benjamin@ceid.org, and I can answer your questions that way as well. I'm going to take a quick drink of water. So if anyone here live has a question, feel free to type it in the chat or just say it out loud. You're welcome. Thank you guys. I see a comment. Thanks, Ben. This was really informative. That's why I'm here. That's why we did this, to serve. And as part of our um, series called CEID Connect, where we're educating the community, families, adults about different things related to hearing and what kind of services we provide at CEID as well for children, for families, and adults. So it looks like this is the end of our presentation. So thank you guys for being here. I'm going to sign off really soon. You can reach us at ceid.org if you have any further questions. And it's been a true pleasure. So we're going to stop the recording now. Thank you guys so much.